All right. So, can you say, I give permission?
I give permission
for
for
this
this to
video.
be used by
NU650.
NU650.
Perfect.
I
And so I'm going to start by saying, hi, Jonathan. I'm Annie. I'm going to be your nurse practitioner today, and I'm going to wash my hands. And then I'm going to start by looking. We're going to go a little bit quicker than we have sometimes, just because this one's really long, okay? So I'm going to look at your head, your face, and your neck. And I'm going to look at the skin characteristics and look at the symmetry and your eyes and ears. So let's look in your skull. Good. Okay. So your eyes and ears look symmetrical. Your skull looks symmetrical. And then I'm going to palpate your scalp and the hair for the texture, distribution, and the quantity of your hair. Okay, hair is distributed evenly. The texture is fine and soft. And I'm gonna test your temporal and masseter muscle strengths. So remember we did this last time when you clench your jaw. There you go. Good job, because that tests your cranial nerve 5. And then I'm gonna palpate your temporal pulses and your temporomandibular joint. So that's your temporal pulses. And then your joint. Open and close your mouth. Good. So that tests your cranial nerve 5 too. And the range of motion of your jaw. You just clenched it so I could feel that. And then I'll palpate your frontal and your maxillary sinuses. So your frontal. Good. Maxillary sinuses. And you're able to clench your teeth. I saw that. Can you squeeze your eyes shut? Wrinkle your forehead like this. Good job. And can you smile? Stick out your tongue. And puff out your cheeks like this. Good job. So that tests your cranial nerves 5 and 7. And then I'll take something light. Can you feel that on your forehead? How about on your cheeks? Good. Okay. So that tests that sensation in your cranial nerve 5. And then the range of motion on your neck. Remember we did that? Yep. And can you extend it and flex it forward? Good job. Good job. And then I'm going to palpate your thyroid and then all your lymph nodes. So thyroid. Okay. And then your lymph nodes, your preauricular lymph nodes are in front of your ears. And then your postauricular lymph nodes are behind. And then your occipital lymph nodes are in the back, towards the back of your head. And then your tonsillar lymph nodes under your ears. And then your submandibular lymph nodes are way under your jaw, and your submental are in the front of your jaw. And then your superficial cervical, your posterior cervical, your deep cervical, and your supraclavicular are all in this area in your neck. So I'm going to feel those, your supraclavicular lymph nodes. Good. All right. And I said your infraclavicular. Then I'm going to auscultate your carotid arteries, and we have to do that one at a time when we listen for any bruits or abnormal sounds. And then to test your spinal accessory nerve, can you push up against my hands? Good. All right, and then your eyes, I'm gonna inspect your eyelids, your eyelashes, your palpebral fissures, and the alignment of your eyebrows. So your eyebrows are even, hair is distributed evenly, your eyelids and your eyelashes are distributed evenly, and the sclera and the conjunctiva and the iris, good. So your pupils are even, the sclera is even, and you know the colors of your eyes, iris. And then I'm going to palpate the lacrimal apparatus. So that's in the outer corner of your eye. Okay. And the bone, your mastoid bone, is behind your ear. Palpate your mastoid bone. And then I'm going to, remember we tested your hearing when I whispered? Jonathan. What did I just say?
Jonathan.
Good job. And then the Rhine test was the one where we put the tuning fork on the mastoid bone behind here, and then we brought it out front and you told me which one was louder. And then the Weber test is when we put the tuning fork back here and then on top of your head, because that tests conductive hearing loss. And throughout this, I would make sure that the otoscope was positioned well at the right height. So I'd want to be at the same height as you. I'd probably be on a stool in front of you. And I'd want to correctly position your auricle and insert the speculum correctly, because that can be painful too if you don't insert it the right way, especially in kids. And then I would look at your nose and the position of your septum. So it'd be in the middle when we looked. No deviation, and it'd be intact along with your mucosa and the turbinates. So the mucosa looks pink, which is good, that's normal. And the patency of each nostril. So remember last time, there you go. Good job. And after I did that, I would test your olfactory function. So remember, you smelled something for me. So here, we'll use this since we don't have the other stuff. What does that smell like?
Mint.
Yeah, good job. Minty toothpaste. And then I'd look at your lips, which are a little slightly chapped right now, but they're pink, which is good. And your buccal mucosa. So I'm gonna look under here. Good. All right. And then I'm also gonna look at your gums and your hard and soft palates, the floor of your mouth, and your oropharynx. If you open up, so the posterior pillar is towards the back, the anterior pillar. So mouth looks good, pink, uvulas pink, intact, no mouth odor, teeth look clean and intact. You have some missing teeth in the front, but now the new ones are growing in. And then you stuck out your tongue again before, but can you go? Good, so that tests your cranial nerve 12. And then say, ah. Good, your uvula goes up. And that tests your cranial nerve 10 instead of 12. And then I'm gonna inspect your upper arms. So let's see and look at your arms, make sure the skin, there's no rashes or bumps present. Nope, I don't see any. And they're symmetrical, your muscles are symmetrical, and they're nice and warm. And your shoulders, I do the same thing. Assess the skin and the muscle mass and the color and the temperature. Good, so I look warm, pink throughout. And then I test your radial pulse, which is in your wrist right here. Good, normal, not bounding, and your brachial pulse up here. Not bounding. Good. And then I would palpate your epitrochlear nodes underneath your elbow under here. Good, they're not hardened or swollen. Good. And then I would also test the range of motion of your shoulders. So remember when you did you touched your back, that was the internal rotation. Good job. And then you also did the external rotation like this. Yeah, good job. And then extension, you extended your arms back. Perfect. And then abduction and adduction. Do you remember this one? Abduction is up like this, and adduction is bringing them back down towards your body. Good job. And then the same with your wrists. Remember, we flexed them down, and then you extended them like this. And then you did ulnar deviation and radial deviation like this. Good job. And then the same with your elbows. Remember, we flexed them, and you extended. And supination, remember? And pronation. And then you did the same with your fingers. You flexed them, extended them, abduction, adduction. And the thumb, you went like this. There you go, thumb opposition. And then I would inspect your chest. So symmetrical, and palpate the costovertebral angle back here. That's sometimes if people have issues with their kidneys, that can be painful. And your Respirations are normal, breathing effort is normal, rhythm is good, and I was counting your respirations before, they're about 18, which is normal for your age. And your lungs are expanding symmetrically. And then I would palpate, remember for the tactile phlebitis, when we fell over here, okay. And I'll percuss your posterior chest for any residents, and I would auscultate as well your breath sounds. So percuss. Pretend I'm listening. Good. Lung sounds are clear. So we already listened to your respiratory effort. And then I would inspect your pulse for any pulsations or heaves. Don't see any of those. And palpate your chest wall for crepitus, tenderness, and the precordium for thrills, heaves, or pulsations. Good. Phone keeps falling down over here. And then I'd palpate the point of maximum impulse, which is right here. You know how your heart's on the left side? Underneath. Good. And your axillary nodes, and then I would listen to your heart. So your axillary nodes. All right, and now I'm going to listen to your heart. And aortic is in the right second intercostal space over here. And then I would listen to pulmonic, the left second space, and Erb's point. That's where you hear the really good heart sounds that you want to hear. That's about right there. And then the tricuspid area is underneath that in the fourth intercostal space, and the mitral area is underneath that in the fifth intercostal space. Good job. And then I would put you in a reclining position at a 45-degree angle to inspect your chest in the recumbent position. That's what they call that. And I would look at the pulsations in your jugular. We did that last time, remember? Yeah. And palpate the chest wall for thrills, heaves, and pulsations. After we get you back up into the supine position, we would sit you up into the supine position. And then I would auscultate all the heart sounds again in the supine position when you're sitting up. And then I'm going to assess your abdomen. So I would put a drape here so that only this much is exposed. And inspect the skin and the contour, pulsations, movement, no abnormal movements. The skin looks good, even throughout, symmetrical. And then I would listen to all four quadrants of your bowels for the bowel sounds. So bowel sounds are normal, not hyperactive, not hypoactive. That's good. Probably because you just ate a lot. They got a little bit active. And I'd listen to your aortic, and then femoral artery, and then your renal arteries up here. Listen for any bruits or hums, and then I would percuss all four quadrants to see if it was tympanic or dull. A little dull, probably because you have food in there, right? And then I would percuss your liver borders, which is in the upper right. And for your age, it'd probably be the span of your liver about 6 centimeters or so. And then I would percuss on the left side for your spleen. Good. And then I would lightly palpate all the quadrants and deeply palpate them, which means pushing a little bit harder. And I would palpate the left costal margin for your spleen and the right costal margin for your liver border, and palpate the midline for aortic pulsation right in the middle. And then in your inguinal area, which is down here, I would palpate for your lymph nodes and any pulses or hernias. We don't have any of those, that's good. All right, almost at the end, okay? And then your lower extremities. So I would put a drape to cover your abdomen. And let's see. I would inspect the skin of your legs for skin characteristics, and the hair is distributed evenly. You don't have much hair on your legs yet, but you will eventually, which is normal for your age. And the muscle mass is symmetrical. Color is pink and even throughout, and temperature is warm, which is good. And then I would do the same thing for your ankles. So I would inspect the skin of your ankles, any hair, muscle mass, symmetry. Ankles are symmetrical, no hair present. And pink and warm throughout. Same with your feet. Feet are symmetrical, skin is pink, warm throughout, no hair on your feet. And then I also look at your nails, so your nails look good, well kept, right? Take good care of your toenails. And your pulses, so your popliteal, your posterior tibial, and your dorsal pedal. Palpate those. It's your popliteal, dorsal pedal. Good. Pulses are palpable and normal. And then the range of motion of your hips. So remember you did this last time, you flexed, extended, abducted, adducted, internal rotation and external rotation. Good job. You're doing a good job. Almost done. And your knees, you flex and extend them. There you go. And then your ankles, remember we did dorsiflexion, plantar flexion, inversion, and eversion. Good job. All right, almost there. And then your neurological, so we did all your sensory functions, remember, with the dull and then the sharp, the different sensations. So you do that on your forehead, your lower arms, your hands, your lower legs, and your feet. Let's see where we're at for time, we're good. Your hands, your lower arms, your lower legs, and your feet. And then the vibratory sensation of your wrists and your Achilles tendon, the back of your feet. Good. And then we will also do the 2-point discrimination of your palms, your thighs, and your back. So remember when I had something and it had 1 or 2, right? Feel the difference if there's 1 or 2. And your thighs, your arms, and your back. Good. And stereogenesis. So remember, close your eyes. You put something in your hand. Now what did I put in your hand? Toothbrush. Good. See how you figured that out by feeling it without even looking at it? That's called stereogenesis. Good job. And then your fine motor function of your upper extremities. So remember you touched your nose with alternating fingers? Good job. And rapidly turned your hands up and down on your lap. Good job. That's testing your fine motor function and coordination of your upper extremities. And then remember of your lower extremities, you ran your heel down the tibia of both your legs. There you go. And then the position of your greater toe. Remember you can feel that last time. Good job. And then we test your deep tendon reflexes and we compare each side. So your biceps, your triceps. So deep tendon reflexes of your biceps, your triceps, Good job. And then your brachioradial right here. Test those reflexes. Good. And your patellar and your knees. And your Achilles. Good. Reflexes are good and symmetrical. And then the Babinski reflex, remember? I showed you this is one that happens with babies. When you run your finger and their toes flare out. But that doesn't happen as you get older, which is normal. And then I'm going to observe your gait. Can you stand up and walk a little towards me? Good. And then the Romberg test. When you cross your arms, good. And you're not, close your eyes, you're not swaying, or good job. And then remember walking on your heels and walking on your toes. Good job. And then heel to toe, and to do deep knee bends when you bend. There you go. Good job. And then I'm going to palpate your spine. If you can bend over. There you go. Okay, spine is good. Midline. No deviation. Good. And then the range of motion. So remember you did flexing, extending back like this, lateral bending to each side, and rotating like this. Twist. There you go. All right. Good job.